What do you know about long haul, chronic, or long COVID? Well, learn more on this episode of Vax Matters.
Our topic today is a good conversation. It's about long COVID, also known as long haul COVID, chronic COVID, or post COVID condition. Now, while you may have heard a lot about the coronavirus, we'll help you understand the impacts of long COVID as well as what we can do to help prevent it. We're very excited to welcome Dr. Michele Longo to the show today. She is a clinical neurologist at the Tulane Center for Clinical Neurosciences at Tulane School of Medicine and currently runs the Tulane Neurology Post-COVID Care Clinic. How do we get all that on a business card? We're so grateful to have her here with us to talk about this. Doc, welcome, and let's begin at the beginning. What is long COVID or post-COVID condition?
Okay, well, first I want to thank you for inviting me to talk about this condition, and so let's get started with answering that very important question: what is long COVID?
Mm-hmm.
You know, what we have come to understand is that most people who get sick with COVID are going to get better within a week or a couple of weeks. But there are some people that will have symptoms either lingering from when they were acutely or when they were sick in that initial infection with COVID. They'll have symptoms that will linger or new symptoms that may develop that will last for several months and will impact in their day-to-day functioning. And these symptoms can come and go. They can what we refer to as intermittent. So there can be good days and bad days. And many different symptoms have been described. Some of the most common have been memory problems or what people refer to as brain fog, which can be problems with focus or concentration, problems with fatigue, sleep disturbances, shortness of breath, gastrointestinal issues, dizziness. There have been over 200 symptoms that have been described in long COVID. So we are trying to understand better what the working definition is going to be. And there are multiple studies. Probably one of the largest ones, which we're a part of, is called the RECOVER study. And this is the NIH, or National Institute of Health's study to try to understand exactly what is long COVID, how do we define it? What is to answer that real basic question that you asked? We're still trying to formulate a scientific answer to that.
You know, doctor, I think that it probably, when you talk about COVID and long COVID, this is kind of a learning curve, not only for us, but for the medical field. Because, well, let's face it, COVID reared its ugly head, back in 2019. So we're still, relatively new into it 3-4 years later. It's always going to be around. We know that it's always going to be around. So, I think my question is, when we first started with the people that had COVID, and then, like you said, most people got better. In the medical field, was it kind of, I don't know, surprising is probably not the right word to use, but when people would come in and say, I'm lethargic, I have this brain fog, I feel like I'm not getting better like I should, was there maybe a level of surprise, or was that kind of expected along with this, trying to figure out what COVID is? Because I know that, as I said, it's been tough to figure out in the past 4 years.
I think, I don't think that it's new that there could be lingering symptoms after a viral illness.
Okay. Okay.
Especially as a brain and nerve doctor, there are other illnesses that we've seen that for. Take polio, for example. We've seen people that may have symptoms long after that. I think that is not a novel or new thing, that there may be some people that have lingering symptoms after a viral illness. But I think that the amount of people that we're seeing, that's a surprise. If I think back to the early years, the early part of 2020, as a general neurologist, I was seeing patients with the symptoms that a general neurologist typically sees.
Hmm.
Things like, headaches and dizziness and problems with brain fog or with concentration or focus. Um, but what I was seeing is that these patients were half the age of the typical patients that I see with these conditions. So younger people, people that were not, that didn't necessarily have any medical conditions prior to COVID, or particularly have a severe case of COVID, were coming to the clinic with symptoms that they were being evaluated for. And I think that part to me was different than what I was expecting or what I've seen in the past.
Well, when you said that some of the people that you saw, of course, the younger age, not fitting the profile of what you would normally see in your profession, you're talking about that they didn't really, some of them didn't have severe COVID. I think that's something that I kind of assumed that only people that had severe COVID that would make its way into the long COVID. I guess I just made that assumption, and I guess it's erroneous that even if you had just a mild case, that you could still have long term or long haul COVID. Is that correct? Or
Yeah,
experience this? I didn't realize that, doctor.
that is correct. And in fact, most of the people that we see had mild infections. Now,
Really?
that's because most of the people that get COVID are not going to be, especially with the newer variants, severe. They're not going to be severely sick with that.
Uh huh.
But by far, the majority of my patients were not hospitalized. In fact, when I see patients and I'm asking them about their COVID infection, I let them know that I understand that you had symptoms, you were sick. I'm asking if you were hospitalized, but knowing that most of my patients were not, and that doesn't invalidate the symptoms that we're about to talk about.
How long is long COVID?
Oh, that's a very good question. So, that's a very good question that I can only have anecdotal um, responses to that question. I mean, I can tell you just this morning, I was um, seeing one of my first patients that I saw with COVID who is continuing to have symptoms, and this is 3 years out.
Wow.
So, there are people that are struggling for years.
Hmm.
Um, there are people that get better in months, but most people, it seems like the symptoms seem to be lasting more like between 12, 18 months.
Really?
So it's not weeks to months. I tell my patients, you know, we're vague in how we answer that question because we don't have the answer to that yet. We don't know how to define recovery. And so until we understand better what does long COVID recovery look like, it's a really tough question to answer. How long does it last? I've seen many people that they thought they had returned to their previous level of health, and then the symptoms come back, and we're kind of have to rethink the whole thing again. So so we don't know, but I tell my patients, for most people, it seems to be more like months. That's not days
Hmm.
to weeks. It's not weeks to months for most of them.
I know when COVID first came about, in hindsight, that was anything even close to what we were anticipating or thinking about. So, as you said, we are learning as we go. And I think that's what's so important that people think, well, COVID, we're going to look at this in the rearview mirror. We're never going to be able to do that. It's always going to be around. So, my question would be, when does your COVID infection, when you have COVID, when does that turn into long COVID? Or is there a way to tell that? Is there a rule of thumb? I know everybody's different. Everybody's, physiological makeup, their medical conditions, different underlying conditions. But is there some idea about COVID turning into long COVID when it happens?
Uh, yeah, this is another excellent question, and it really depends on who you ask. And I'm talking about even among well-respected sources like the CDC, the World Health Organization, NIH. Everyone has different um, definitions right now of long COVID. We're trying to change that with the information we're learning from Recover and other studies. But um, but most people will say that symptoms that are interfering with day-to-day functioning that are lasting somewhere between 4 weeks and 3 months.
Hmm.
I think anecdotally speaking, from the experience that I've gained over the past 3 years with the clinic, I tend to think that 3 months may be a better number for us to use right now, really, because if we say, hey, at 4 weeks, you should start, seeking care, I think we'll see that a lot of people will improve in that time.
Hmm.
But there are, by the CDC definition, it's 4 weeks. If you go to World Health Organization, it's 3 months. So somewhere in there.
Wow. So much information about this. And you said earlier about people seeing the number of people who are still dealing with that. And Diane and I have done a number of these podcast episodes, and it does seem like the dialogue nationally is moving further and further away from COVID and the precautions that we should be taking in protecting ourselves and our families from it. What's your read on that? Do we need to talk about this more to make certain that this is still a very, very dangerous thing for all of us, adults and children?
Well, I think whenever there is something where your health is concerned, that you can do something to lower your risk of being sick,
Right.
then we got to highlight that.
Yeah.
And as everyone kind of struggles, well, as everybody moves on past COVID, I mean, COVID fatigue's a real thing.
Right.
I mean,
Right.
we see that, right? Well, there are some people that are still struggling. And right now, we don't understand all of the risk factors for being somebody that gets long COVID. So, as I said, I see plenty of healthy, previously, had no health conditions. I see professional athletes. I mean, we see all kinds of people that struggle with long COVID. But one thing that we're coming to understand is that if you can reduce your risk of being seriously sick with COVID or being reinfected, you may reduce your risk of long COVID. So anything that keeps you out of the hospital with COVID will potentially reduce your long COVID risk. Anything that keeps you from getting COVID in the first place, like vaccinating or masking and doing these things when appropriate, will reduce your risk of long COVID. So I think that message is still something that we need to make sure people are aware of. And if you get COVID, to receive treatments that can reduce the risk of being hospitalized. So vaccine, treatment of COVID, avoiding, through masking and social protective measures are all still very relevant messages.
There is, as crazy as it may sound, there is some optimism in what you have said about long COVID. I happen to know some people who are still having symptoms very long after having had the coronavirus and are at a place where they think, well, I'm never going to be able to get rid of this. They actually just may be dealing with the long haul symptoms of COVID that may eventually go away, correct?
Yeah, but I think it's important. Just a caveat I want to make sure that is clear
Okay.
is that it's very important for people that are having symptoms that they're relating, to a COVID infection,
Sure.
that they continue care with the clinician that knows them best,
Right.
with their primary care doctor, because long COVID, is a mimicker of other conditions. So it's really important to, to establish care with a good primary care clinician.
My question too, when you're talking about long COVID, doctor, can a person get COVID from someone who has long COVID?
That's an excellent. I'm glad that you asked that because no, when you have long COVID, you're not infectious.
Okay.
Oh, wow.
So,
So
okay.
that's real important
Right.
to know. So, um, So no, long COVID is not contagious.
Case closed, bottom line. Don't have to worry about it. Okay. Okay. All right.
So what are some of the more serious complications that can come from having long COVID?
Well, I think some of long COVID, by its definition from the World Health Organization, it interferes with your daily functioning, which
Mhm.
means it interferes with school and work and doing your chores and taking care of yourself or others that you're responsible for. So that's a real issue with long COVID. Um, it is a condition that if it is interfering with two or more areas of your life, it will qualify for disability, or many of our patients do need accommodations at work or at school. So I think that's a real serious consequence. If I look at the health consequences, and you think that a lot of people that have long COVID, so I said uh, they're at a time in their life where they're typically being productive. They're younger people,
Hmm.
a lot of them, not all, but many. And so this is interfering with our workforce. We know that they just had a report come out of the UK that there's a long COVID doctor group, and they believe that 1 out of 5 of their doctors is not at work because of long COVID. It's interfering with
Wow.
the workforce. But I want to point out something else, that because my patients ask me, can I die from this? Well, we need to make sure that that long COVID is not mimicking another condition. And so that's real important to keep in mind, right? But the other part is there is a mental health burden that goes along, not just with the pandemic and what we've been through, but also with long COVID. It seems to sometimes flare previous mental health conditions that were well controlled, or we'll see new onset of mental health conditions like anxiety or depression, people that have never struggled with this. And I think there's a real concern for suicide, and people need to be supported, validated. They need to be heard. This is a dangerous time for isolation. And when you're sick and you have something that we refer to as an invisible disability, I think it really increases that risk of being socially isolated, and that's not a good thing.
Thank you for bringing that up, doctor, because it just goes to the heart of the matter that with something like this, with long COVID, you want to get well. You're trying to get well. You're not just crying or whining about something. It's
Right.
real, it's symptoms. You don't want your friends or family to say, well, you should have been feeling better by now. Oh
Right.
my gosh, why are you doing that? You need to be, as you said, supportive, because that leads to, as you said, the anxiety. Why am I not getting better? My mental health, your mental health, that's critical, because sometimes, you keep thinking, okay, I'm sick. I'm sick. I'm sick. And, your brain can do a lot. As you know, your mental health can maybe kind of get you into this rut that you can't get yourself out of, that it's hard to even get yourself out of it, doctor.
Absolutely. Yeah, it's a we there was a term that I first heard in my work with long COVID, and that is a term that was called medical gaslighting. And
Oh,
medical
yes.
gaslighting
Gosh.
was, people were coming to see me and they were saying that they had these symptoms, but that they weren't believed by their people at work, by
Uh-huh.
their families, uh, by other medical professionals. I mean, I see less of that than I think I did, a year and a half or 2 years ago. Things like what you're doing here, when we get word out about long COVID, um, it helps not only for the patients to be believed, but for everyone else that hears about this. When Admiral Rachel Levine talks about long COVID, she always starts with long COVID is real.
Mhm.
Yes.
And that is
Yes.
so essential for not only for the patients, but also for anyone in healthcare. All of us need to understand that that we need to believe what people are describing to us, that long COVID is a real thing. It's real.
You mentioned earlier some of the preventive measures that we can take to avoid contracting the coronavirus in the first place. But if someone has long COVID, what can they do to hasten its departure from their body?
Right now, our treatment for long COVID is treating the symptoms. And a lot of that is finding out what are the most bothersome symptoms for that individual and what can we do to treat those symptoms. There's not a magic pill here. It's not something that you can walk in and treat, all these varied symptoms with just a capsule. So we try to first identify what are the most bothersome symptoms. For a lot of people, it is they find that when they exert themselves, they're worn out. They post exertional malaise, and so first of all, it's important that we make sure that these patients have seen the appropriate specialist to rule out, organ damage from COVID itself. I mean, that's a very important thing. Once we do that, then we start to look at interventions that can be helpful. Many of our patients have benefited from seeing different therapists, like physical therapists, that help them to understand how much exertion can they do before they get to the point that they need to stop. We want them to stop just short of having their symptoms. You don't want to push somebody to to what the patient will refer to as a crash, which is, like 72 hours after they've exerted themselves, that they feel terrible and all their symptoms have been flared. So sometimes working with a physical therapist can help with that. Helping patients. A lot of our patients have sleep disturbances, and we try to help with good sleep habits and hygiene and doing sleep studies where necessary. We have cognitive therapists that help patients that are struggling with brain fog, that have problems with focus or concentration, to develop the skills that can help them to exert less mental energy in the activities that they're doing. And same with occupational therapists that help our patients learn how to conserve energy. So it really is a team approach. These are some of the things that we're doing. Recover is just beginning to do some clinical trials. So we'll learn more as we get more information. But right now, the treatments for long COVID are symptom-based.
And I think that everybody that was listening earlier, when you said did you say 200 symptoms? Is that what you said?
Over 200 symptoms have been described with long COVID.
Wow. Who's most at risk for long COVID?
We are just starting to understand that. There have been multiple studies that have shown that certainly if you were severely ill with COVID, that's a risk for long COVID. If you, we think that people that were not vaccinated that get long COVID tend to have a harder time with long COVID and be at a higher risk. There have been some studies that have cited other underlying medical conditions like obesity or diabetes or having other conditions like this as risk factors. That's still being worked out. But I think that it is clear that the number one risk factor for long COVID would be being someone that was severely ill with COVID.
How does a vaccine impact long COVID?
The vaccine impacts we understand that it decreases the risk of long COVID. And it seems like from our first studies that are coming out from the Recover study, that people that are vaccinated may have a lesser long COVID. That remains to be seen, be less symptomatic with it. But vaccine reduces the risk and by reducing your risk of being seriously ill with COVID, even exponentially so, in that way reduces the risk of long COVID. Other things that we don't have, I don't have the science. I could tell you anecdotally speaking that I early on heard from a lot of my patients that when they were sick with COVID, they push themselves through that. They didn't give themselves rest. They didn't take the break. They were not in a job where they could take a break. And so, I see a lot of people that are coming from healthcare, from service industries, people that may not have been able to take the time and rest and recover from that initial infection. But I want to say again, that is anecdotally speaking. We don't have the science on that observation.
I'm thinking that sometimes too that when we were talking about the younger population that seemed to be so impacted by COVID and long COVID, and not just the older population, because we know older folks had more challenges, or the population that has the underlying conditions. But I'm thinking too that with the ones that have been healthy, for a long, forever, their 30s, 40s, and 50s, they're thinking, like you said, I can power through this. I can do this. This is just going to be a little bit of an inconvenience. And then when it's not, it's like, what do I do?
Right.
I am surprised. I am flabbergasted. I don't want to have to take. I think you said you could qualify for disability if you need to. I think doctors, so many times, we're not used to taking care of ourselves. We just need to be good to ourselves, to give ourselves a break, that, that everything is good until it's not. Be careful and allow yourself to heal. And that's what we were talking about with long COVID, about the fact that you get so disturbed and so discouraged and so mentally depressed that you make yourself go into a tailspin almost.
Yeah, absolutely. I think, we somewhere along the line of this pandemic, we got the expectation that if you were sick with COVID, you just worked from home, just as if you could do that. Well, that many people couldn't do that.
Mm-hmm.
And even people that could, celebrities and political figures that would get COVID and go on the national news and say that they were working from home, they had COVID. I think that contributes to this expectation that when I'm sick, I'm supposed to be working. And I think that when you are sick with COVID, you have to rest. You need to let your body recover. And the expectation should be that you don't feel lazy or guilty for taking time to recover.
Yeah.
Wow. A lot of great information. Is there anything that we might have left out or not touched on?
So I think it's important to keep in mind that long COVID is not a rare condition. The estimates are that about 10% of people that get infected with COVID may go on to have long COVID. So it is very likely that you know somebody who is struggling with long COVID. If you have concerns about long COVID, you should either see the physician or the clinician that knows you best, or establish care with the primary care clinician that can then determine if specialty care is needed.
And again, to be good to yourself and to not be discouraged, not thinking, well, I should be well in a month or 2 months or a week or two. Just to know that it's out there, that it's real, that it's legitimate. And as you said, to talk to your doctor. That's the important thing, to have the conversation. So, doctor, thank you so much for having this conversation with us today. It is going to impact many people, many friends, many families on how they can have that same conversation with people that they love. So again, thank you. This has been another wonderful and very informative and important conversation here on Vax Matters. Thank you to our listeners for tuning into this episode, and we certainly hope you will join us again the next time.